But first, we all know now how China misled the world over the coronavirus pandemic and covered up evidence of the virus when it should have been alerting the world. Even now, months and months after the very first cases, people who speak about the virus and China's early role in its spread are going missing and are being arrested by police. I interview the brother of one Chinese activist who went missing just a month ago on my special investigation at 7:30 p.m. tonight, so stay tuned to Sky News for that. But there are now also ongoing questions over the World Health Organization's role in spreading inaccurate information about COVID-19. The World Health Organization told world leaders there was no need for travel bans, that this wasn't a pandemic, and that the coronavirus was not infectious. It is just extraordinary when you think that they made those statements in January, and if they hadn't have made them, thousands and thousands and thousands of lives could have been saved. At the time, there was strong evidence to the contrary, and that's why Australian Prime Minister Scott Morrison did bring in those travel bans against the World Health Organization advice, and it's why he did declare there was a pandemic a whole fortnight before the World Health Organization acknowledged that we were dealing with a global pandemic. Now, I interviewed the World Health Organization spokeswoman Margaret Harris about all of this just a few days ago. I started with this fact. Now, there was a WHO fact-finding mission into China in February that involved 25 experts. I asked Margaret Harris how many of the inspectors actually went into Wuhan. Here's what she had to say.
Initially, in fact, the mission was not even going to go to Wuhan because there was such intense transmission at that time. It was agreed that a small number of people could go in. My memory, I think, is 3.
I then asked her whether they requested permission to visit the wet market at all.
I do not think so. I do not have that information, to be honest, but I would not expect that would have been part of. I do not expect that would have been a request at the time. The wet market was not the main focus.
I followed up with her on this point after the interview, and she confirmed in writing that the 3 officials, only 3 out of 25, who went into Wuhan were Bruce Aylward, Chikwi Ekwezu and Tim Ekmans. She confirmed there was no trip to either the wet market or the laboratories that are now of such crucial importance to tracking down the origins of the virus. As an explanation, she said this. She said the focus of the mission was on learning from the response, not looking at the origin. So the wet market, lab, etc. were not on the agenda. And that's a direct quote from her in our email correspondence. During our interview, I also asked Margaret Harris about whether we could expect an apology from the World Health Organization for their insistence that travel bans were absolutely not necessary, a decision that directly cost lives.
We didn't say don't put a travel ban. We said understand where the outbreak is, understand who's coming to your country, understand whether or not you need to be screening. Countries are permitted to go beyond what's recommended. They are asked then to go back to us and to explain why.
I pointed out to her that Tedros Adhanom, the Director General of the World Health Organization, actually did come out and say there was no need for travel bans.
That wasn't exactly his words. He was saying that you don't put a blanket ban when you limit travel.
The World Health Organization now has serious questions to answer about whether it made the spread of the virus worse through its inaccurate information that you could almost call disinformation. It's extraordinary to me that in the face of all available evidence now that travel bans were not put in place, that even now the World Health Organization is refusing to admit it made any mistakes. No apologies at all, no regrets. If it doesn't accept that it made crucial mistakes in those early stages of the virus, how can we expect anything to be different the next time a pandemic hits? How can we ever trust their advice again?